Good afternoon, everyone. Happy Friday. This is Connie Burke, Associate Commissioner at OASAS, working in partnership with my colleague, I think Debbie Davis. She's like becoming my other half at this point, as DMRP works in partnership with DFA. Hey, Debbie.
Good afternoon, everybody.
And I also want to note that we do have some of our staff from the OSF project management team on. You see Lucia Clark and Kristen is on. I'm just looking too to see who else. I'm looking for Denise. Is Denise going to join? I think sometimes people should huddle at desks so you can all be seen together on the screen. Happy to see Kim Benchoff joining us from the regional office. And for today's check-in on regional abatement, couple of things. We're very happy about the reporting. I know this is something we've been talking about for many months, and I appreciate everyone getting reports in. And I say everyone, but I think that we have a few outstanding. Lucia, I know you sent me the number, but of all the reports we were supposed to get, I think we have upwards of 90% of them, 95% of them in. So I appreciate that very much. And also recognize that we were kind of asking you to do the impossible. Report out on money that you barely had in your hand long enough to think about how you want to spend it, and also asking you for information with regard to the direct shares that came through the Attorney General's office. So we appreciate that. The team has put the information together, and I wanted to share, if I can do this, a graphic. Oh, Lucia, can you help me? So just in terms of kind of where we're at with, given the reports we've received so far, the team has put together a graphic to show how much has yet to be encumbered, right? There's a lot of planning and discussion that's still happening, how much has been encumbered, and then also how much has been spent. So we did it across the state, right? So we did it for everyone. This is statewide. And in terms of, how much information we're going to include in thank you, Lucia, very, very much. So Lucia, do you want to walk through the story you're telling with these graphics? Or I can.
Yeah. So if you take a look at the top, so a couple of things that I think we're just hoping to kind of convey to the Opioid Settlement Board, right, is that by virtue of the settlement, and how we've been speaking to you about the funds, these funds are yours. While you have to stay inside the 10 focus areas, you get to decide how you want to allocate and spend those within the 10 focus areas. So we are just trying to give some very high level, all of you as a group, whether you're a local government unit, an other litigating entity, or a 5 large city, we just broke them out by those 3 groupings, but just to show them really how little time you've had and that, 100% of the money was sent out, but the encumbered is only 37% of all of you as a group of LGUs. And then what's actually really been spent is 6%. And this is normal. I think we're trying to normalize for them the time that it takes. There's many people who are a little bit impatient. We all want to solve the opioid epidemic today. But just to kind of show them, and as they have had presentations to the board, right, that these are the local government processes that happen. Not everybody has to do the same process. And, if you know one LGU, you know one LGU. So just to kind of temper their expectations, and obviously in the future, we'll want to give them a little bit more detail than this. You could also look at it as a pie chart. It looks a little more fancy, a little more impressive there. But I mean, those two things say the same thing. So, um, Connie, did you want me to go further or?
I mean that's good for right now. And I think that, you know, the story that that it's important for folks to understand, and you know, just what Lucia said, you know, there's a crisis, people want to see that the dollars are out there, they're being spent, and the fact of the matter is that there are processes that we all have to follow, whether at the county level, you know, even at a town administrative level, all the way up to the state level. And so it's not like, you know, we can see millions of dollars poured into the system and spent, right? I mean, even providers, you know, it takes them time to spend the dollars even once they have funding in hand. And then, you know, another thing, and I'm assuming this will be true for you as it is for us on the state level, you know, we recognize that, especially in 2025, amounts, thank you, Dr. Giordano, for reminding everyone of this very important point, that come 2025, the dollar amount significantly drops. And so it's really important that we're planning, and I'm sure that you, like we at the state, are looking at how we use these dollars over time, right? So you're looking at multi-year initiatives, and so we are the 2023 appropriations to actually support projects that are going to go on for 3 years. And so, of course, you're not going to see all the money spent because you're doing longer term planning, right? You need the 3 years in order to spend the money as you've planned. So it's just, I think it's important for us to be able to explain to folks what the process is, and that too, you know, we're trying to do some longer term planning here, right? We're trying to be thoughtful. We don't want to do a quick one and done, or a one and then there's no way to continue, right, with that project or that initiative after a 12-month period. So we're putting this information together. Know that we will be providing some level of reporting that will go into the report that's due November 1st. It's not just about the Opioid Settlement Fund Advisory Board. It's also about the legislature and our governor being able to demonstrate and report out the work that we've done. I also, let's see, so we've talked about 2023. I am really interested in conversations that we want to have with you around the planning and the collaborating and your process for figuring out how to use these dollars. And so we do intend, I think, in November to reach out. We want to have some focus groups, essentially. I think that's the general idea, and invite LGUs to participate so we can hear about your process. We can also understand what challenges you're running into, interested in also hearing, like, how are you problem solving at the county level? And in particular, problem solving around the fact that there's AG dollars coming in, there's regional abatement dollars coming in, you've got more coming in 2024, and kind of how you're thinking about it. So I hope that folks take the time to participate in those. I think that you guys have great stories to tell, and we do want to hear, about your process and how things are going. So I'm excited about that, and I hope you guys get excited about those conversations. We're all learning as we go. I said that from the beginning. This is just one great big learning curve that we're on, and we're only just at the beginning. And then the other thing I wanted to mention, oh, actually, let me not. So too, with regard to reporting, so one of the things that that folks, the team saw in reviewing the reports that came in, is that in instances, and understandably, there are occasions where actually the AG dollars and the regional abatement dollars, you're kind of throwing them into one pot, and then you're planning and you're executing based on that larger sum. And so completely understandable. And so too, what we saw was that in some instances, folks were like, well, how should I report this, right? Because we asked for the regional abatement dollars in one section and then the AG dollars in another section. So we were talking about how best to provide guidance around that, because this is like a long-term exercise that we're in terms of this reporting. So Debbie, do you want to talk about that for a minute? what we
Yeah.
decided or what we thought about?
Yes, sure. I would love to talk about our level accounting concepts, because I know on a Friday that's what gets everyone excited and keeps everyone awake on a, on a virtual call. No, just simply, if you might have been able to set up an account, where you were receiving monies that were given to you that came through the AG's third party, not from OASAS, and it was assigned to you and you put it in a separate pot. Then the money came to you from OASAS and you kept it in a separate pot and you were looking at it that way. So what I'm about to say does not apply to anyone who had that as how they're accounting for their funding. This is what we're going to share for those of you who said, oh, you know what? I received funding through OASAS, and I also received funds that was distributed through the AG, and I put them all into one pot, and I'm going to use this whole pot to fund, my planned spending related to the plan that we handed in, right? And harm reduction, treatment, investments across the service continuum, so forth. If that's the case, we're hoping that you might be able to do a cost allocation methodology, self-imposed, totally from a perspective of just saying, I know that I'm going to use a really simple example. In your fund, when you mixed them all together, you have $100, but you know that 50 of those dollars came from the third-party administrator, and the other $50 came from OASAS. So from a cost allocation aspect, it would be 50% of your spending out of that fund. On average, 50% is being funded by the AG's money, and 50% is being funded by OASAS's opioid settlement fund account funding. And then every time you report, it would be, oh, my expenses were you shared, because you're not tracking which revenue source. You dumped it all into the same revenue source. The reason that we say that is because this is an interesting perspective of law, right? But the settlement funds that flow through the state treasury and come through OASAS, it's part of our mandate. We have to audit them. And so in a way, we're supposed to come at some point, knock on your door and say, oh, for this time frame, please show us your records, randomized selection, and show us that you spent the OASAS OSF dollars, right? And so, the truth is you've blended the money. So 50% of every expense you would show us is the OASAS amount in my example. So it would just be showing that from a cost allocation perspective. We're not going to check your cost allocation work. It is for you as the accountants to say, this was the amount I got. I divided the whole by the amount I got from, OASAS, and I know what percentage was that. That's what we were thinking. So I know Amanda has had her hand up that I see very patiently waiting. And so Amanda, go ahead, ask your question.
So I just, and forgive me because I'm just kind of joining, and I had a conversation with Constance last week about this, but we went back and forth with the county because the county was handling the AG money, and then we had the OASAS money, and then we went back and forth, and finally it's come to a consensus that we're going to just manage all of the money for reporting purposes, because there was a little bit of confusion as to what it was supposed to be utilized for and things like that. So, but in my review of the settlement, it looks like the settlements, now I know this isn't necessarily particular to OASAS, but kind of going back to the pooling of the funds, each settlement had a distinct usage. And even though OASAS has the 10 service areas that you could have put the funding into, like I'll use allergen, for instance. I think they only had like 5 areas or 3 areas that you could have used it. Like harm reduction wasn't one of those areas that you could have used the funding for. So is that going to become an issue with pooling? Because this was part of the conversation that I had to have with regards to deciding on programming and how we were going to allocate funds, is that they were very particular in those settlement agreements.
So, my understanding is from when our legal counsel reviewed the settlement agreements and also reviewed the board's recommendations, right? That none of the recommended spending priorities came in conflict with any of the settlement agreements. So specifically, the words harm reduction may not have been mentioned in the settlement, that settlement agreement, but I believe that funding abatement and anything related to abatement, like a treatment or, a prevention activity, like harm reduction is considered a treatment. So
Right.
it's a
Okay.
matter of how you categorize it, because, so it can fall, harm reduction activities can fall under different spending categories. Yes, the board made it a separate category, but it can be categorized as it could be categorized as investments in, investments across the service continuum.
So the supplies, like if somebody bought supplies, harm reduction supplies, that would be, because that was what the question was, like if they bought fentanyl test strips and were just distributing those, like, is that really considered? Because I know in some of the grants, it wasn't, like federal grants, they were excluding that from, some of the, usage for federal grant money under some of the, like HCS actually.
If it's an active user, right, and a fentanyl test strip prevents them from dying of an overdose, I don't know. I mean,
I agree with you. I'm just saying, I don't know.
I mean, Connie, I am the fiscal person, and I have only learned the amount that I just said. So programmatically, there might be other things. And I see Dr. Giordano has raised his hand, so I don't know. Steve, do you want to?
Well, yeah, this is Steve. I was just going to say, I mean, it's a very interesting point that's being raised, but, we made those terms up at the board. So I think the spirit of those 10 categories was just as you're talking about, Debbie, to encapsulate everything opiate service related. We could have called them 10 different things, and whether or not it fell within the specific language of any of the individual litigation, I think that kind of gets mind-boggling because people choose different terms to describe, I think, ultimately the same spirit of these settlements. So I'd rather be sued at the back end, as to why did you do this, than to worry about it on the front end and not help people.
Right.
Yeah, and I just want to say, I think that the settlement agreements are broad enough.
Right.
I think Amanda, you're raising a point because obviously, and I don't know what hat you wear, Amanda, so if it's fiscal or program or community services, so I apologize, but
It's okay.
I know you're trying to protect your LGU. And so I think because it's broad enough that you can make a case for why you're spending in a certain way, as long as it's for abatement purposes.
Yeah, I don't think I'm worried so much about, I guess I'm not worried about the OASAS side in the OSF funds as much as I'm worried about if we're combining those funds with the direct funds, then do you run into this? Do you see what I'm saying? Like, I think we have protection with OASAS and with you under your understanding and your verbiage of how we were intended to use them, but I think I'm worried on a higher level on the other funding as to how that should have been appropriated. So
Amanda, I'm sorry.
Oh, so sorry. What I was going to say as a solution, and we'll certainly take this back to our legal, but there might be, like, if you have legal, right? This might be a legal thing to give comfort, to say, I still really believe, because of our legal counsel, that the settlement agreements, the language in each of those agreements still would fall under any number of our buckets. So if you're doing state abatement work, whether that is buying fentanyl strips, or you're buying naloxone, or you're expanding treatment, or you're, I believe it would fall under. But if there's a concern, maybe we can put counsel to counsel together. you know, as an option. for
Right.
solution.
Okay. Yeah. I mean, our council is
comfort.
not really, that's what's a little interesting. They've kind of taken their hand. I mean, they're dealing with a lot of the other, I mean, we're, a small county, so they're dealing with a lot of the other issues going on with some other litigations that a lot of the counties are facing on the upstate regions. But I mean, I think I'm just, like I said, I think it was more concerning that there was even misunderstanding of the, that the non-restricted use was considered like, oh, this free use of completely non-restricted, and that's actually not the case. So I think there was some concern, like I had some concerns there. Just that's why we started taking, I think, a higher degree of representation and the use of the county funds, the direct funds, because I think there was just some misunderstanding all around as to how they were supposed to be utilized. So,
I mean, Connie, let me know if you feel the same way. I mean, I think that if there's still some concern, because I don't want you to feel like I'm being flippant about it. Because I know that our council has dived in on each of the settlement agreements. If you want to have like a conversation of more on a legal, and I think we could do that. Even as a check-in one time, we might be able to invite legal to one of these meetings and just have a general check-in. I'm sure they're going to love me for saying that. No.
I'm sorry to put you in words.
I mean, if that would be helpful. Do other folks think that would be helpful? You can like raise your hand, or I guess, use your little hand.
Shoot confetti with your emojis or something.
Oh, there you go. There you go.
Oh,
I
there
can't
is
see them
such a
all at the same time.
There we go. Yeah.
Oh, look
Thank
at you.
Mike has a question. Got your hand up? Mike Dutra?
I was just agreeing legal would be nice because we're just learning about this now in Saratoga Springs. So we want to make sure we understand how everything works.
Oh, welcome to the call, Mike.
Appreciate it.
And your timing is still good because this is going to go on for 16 or more years, 16 or so years. So you're still getting in on the startup phase here.
Excellent. Thank you.
And also there's a question, could we get these parameters in writing? I see a head shake. I know there was a comment, another comment earlier too, so asking if we could get this in writing. Debbie, can we articulate this?
Well, I think that I think the idea is that, and I'm not sure, but I think the idea might be better served by, let's see if legal can be available for the next call, and we can go through some general Q&As. And then if there are any Q&As that come up that can't be answered without a little more research on legal's part, then that Q&A that follows that call would list everything that we've covered on the call and anything that they had to research afterwards. Mm-hmm. Does that sound fair?
That sounds good to me. And I mean, I'm happy to assume that as the topic for our regional abatement meeting next month. And that gives us a month to get it on council's calendar. So if folks do have questions, that would be an opportunity to bring that up. That sounds good.
If we could get them in advance, Connie, maybe we can share them with legal and then, have some answers on the call. So if you all want to send these types of legal questions exactly as your legal folks would ask them, and then it's like we're making all the legal people talk to each other. Then maybe, depending on how quickly those come in, and if we have answers in advance, we can share those and then go over new ones that might come out of the conversation.
That's a great idea. So whatever your legal questions are, your accounting questions are, you can submit them to the Opioid Settlement Fund Project Management mailbox in the next few weeks. And we will plan to have our legal counsel on the regional abatement call in November to answer those questions and any additional ones that you bring to the meeting. And then we'll be able to post that question and answer document for folks to use as guidance. I see, so hopefully that, Sharon, you're asking about parameters for both fiscal reporting and data reporting with due date. So, so we can include that, right? And in terms of like the data reporting, we are trying to get into a cycle, and we've kind of put up the timeline, the time frame in the last meetings for folks to see. We really want to make this as easy as possible, and so we are aligning the reporting with calendar year, which is also your fiscal year. And so this first report that we asked for you to submit by August 1st is just like covering our bases early on, and so that we have some information to include in the report this year. Going forward, we're going to be asking you to report out in March. I'm looking at Lucia. I think it's March on the previous calendar year's spending. So we're going to get into an annual reporting schedule that will follow the calendar year. And we can share that timeline, those dates. That'll be part of the question and answer document, because we want to have a regular cycle so everyone knows, and it's just on your calendar when things are due. Thanks, Lucia. She put the mailbox address in the chat, and also a request to send legal and accounting questions. Anything else with regard to the reporting, 2023 dollars? If this is your first time joining the call, please be aware that on the OASAS webpage, we do have recordings of all of our regional abatement meetings. So, maybe when you're driving in the car, you want to work your way through past meetings. They don't all always last an hour. So maybe you can get one in like on a trip to the grocery store and back or something. But do look at the information that's available online. Information about the reporting is available online, and we also have some nice graphics around some regional abatement planned use of funds. So we can also post that. Can you, PM team, can you put the address for the regional abatement information with the webpage address in the chat so folks have that? So here's a question, thank you. So Amanda, when I talk about the 11-1 report, know that in statute, OASAS is required to report on an annual basis on the use of opioid settlement funds, and that's what I'm referring to. So we do work with the Opioid Settlement Fund Advisory Board in drafting that report that needs to be submitted on 11-1. So that's not on you. We're going to maintain a regular cycle of annual information gathering from you guys. Like I said, the next report will be due in March, and that will reflect your 2023 spending. And it's that information we'll use to inform the report that's due later in the year.
And are we going to include, just for clarification, the 2023 report that we provide in March will likely encompass what we've already put on the report that we've already given to you, correct?
Right.
Okay.
Yep. Yeah. And I think we laid that out in instructions, like what we're reporting on for each of these time periods. So is that posted on the webpage, Lou?
So, I mean, sorry, just to speak a little bit to what you're saying, Amanda, right, is that like what you report to us in March, you've just reported a little bit of that to us, right? But
right.
Then you're gonna, yes, what you're gonna report to us in March, I would say like just approach it as like
a full year's report.
Start. Yeah, a full year's report and a fresh start. Like you don't have to worry about what you reported to us for this year.
Okay, like worrying about subtracting it out.
Exactly. Don't do that. No. Yeah.
Okay. Any other questions? Folks, feel free to raise your hand or unmute yourself and jump in. Okay. So the other thing, Lucia reminded me that I'm constantly saying to you guys, like, oh, we're going to have that we're hoping to have that in a month. But she said 2 weeks. Like I always say, you're going to have it in 2 weeks. You're going to have it in 2 weeks. 2 weeks later, I say, you're going to have it in 2 weeks. So talking about the 2024 appropriations, We are waiting for final numbers so that we can make 2024 funding available to you. So keep in mind that the report that you submitted to us for your 2023 spending so far is the required document that will allow us to then make payment. So once we have final numbers from DOB, we will do our calculations. We will do a notification to you like we did last time that says the county's getting X amount. If the county is passing dollars on to one of the smaller other litigating entities, that will be indicated. And you'll get the letter, and then payments will follow. So I want to say that we're going to have that for you really, really, really soon. I think once we get final numbers from DOB in terms of kind of doing the calculation and getting the letter out, we can do pretty quickly. The team is becoming a well-oiled machine in that regard. So it's just about getting those final numbers. So within 2 weeks, now I don't know, as soon as we can get it for you guys. I think that people are probably still working on 2023, given Lucia's report, but I'm sure you want to know what that amount is as well. So you can take that into consideration with your planning. So as soon as we have it, we're going to get that out to you. Okay, questions about anything regional abatement? I don't want to say more broadly, anything opioid settlement fund, but if folks have questions and we can't answer them right now, we will certainly get answers for you if folks have anything else outstanding. I will pose one question to the group. I know that, again, monthly attendance can sometimes be challenging. I am willing to hear from the group in terms of whether monthly meetings are still most effective. If people feel we would be better to move to a quarterly meeting schedule for this, I'm open to that. It may still feel too new to move to a quarterly schedule, but feel free to comment on that or to shoot us an email and let us know what you think about that. Sometimes it's just nice to get together. And I appreciate just having an opportunity to have some open, an open communication channel amongst all of us.
I think it's just good to know you're there, Connie.
We are here. We are here. Like I said before, we are all in this together. It's a very challenging and highly unusual situation that we find ourselves in. It's good, right? It's great that we have these dollars. It's an unfortunate reason why we have these dollars, but we're all learning as we go along here. The other thing that I will mention too, is, and I don't know, well, this should be a conversation we have. I'd be super also interested in hearing how folks are thinking about evaluating the use of funds, or to the extent that at the county level you're thinking about that, what you're considering for other data that you're using to kind of assess the impact of the dollars. I would be happy to also plan for one of our future meetings to talk a little bit more about the evaluation plan that we have at the state, and know kind of what we have and what's in the works for that. I will say that there are components of the evaluation plan that I think will be helpful at the county level, at the regional level. We are looking at, statewide, and we are looking at initiative-specific measurements. So that may be helpful to folks. All right, so thanks for responding. A couple folks have responded to say quarterly. Going to quarterly is too soon. It feels too soon. I appreciate that. I'm feeling it a little too, like too soon. So we will stick to the monthly cadence, and we can check back in on that, in a few months or so to see how folks are feeling. And again, I'm happy to maintain this every month. I think that it's just good. Even if we don't use the full hour, it's a good opportunity. Lucia, did I miss anything that we should cover today?
I think that's it. You talked about the focus groups, right? And
Mm-hmm.
yeah, no, that's everything.
Jennifer, did you want to say something? Jennifer Hayden, I just saw that you were unmuted. I didn't know if you wanted to jump in. Which can be difficult to do with me because I talk constantly. Folks, going once, going twice. Anything else for today that we want to discuss? We have time. We could do an icebreaker and talk about our favorite fall activity. Amanda, are you just waving goodbye or do you have a question?
No, I do have a question, and I didn't want to, like, if you were going to hang up, I was going to let you go. But so the one question that I have is that for audit purposes, like a lot of, because there's multiple agencies within the county that are making payments out on these programs, I may be getting just the figure and maybe what it's in relationship to, but should we be keeping like a copy of the voucher and what it was expended on, so that way for audit purposes, that, like, since we're keeping track of it, because this is part of the process, right? This is why we had back and forth with our administration as to who was going to be kind of the gatekeeper. Should we be doing that? Should we have that readily available for every dollar that's spent? That's what we were trying to figure out, because they're going to be coming out of, we have two separate funding accounts set up. So
yeah, I'm not a fiscal person, but I've heard enough. I've listened hard enough to Debbie Davis to say that yes, you should be maintaining that documentation. So you should assume that you could and potentially be audited for any use of opioid settlement funds. So you absolutely are responsible for maintaining that documentation and being able to provide it for an audit.
yeah, I mean, it's don't get me wrong, it's there, but I'm just saying, like,
Yeah.
do we personally need to have it as the LGU, or is that something that we, like, at some time just need to be able to retrieve from someone? Do you know what I'm trying? That's what I was asking.
No, I do hear what you're saying. So I think that whatever your standard accounting practices are as the county is what you should be maintaining. And I'm not the best person to answer these questions. I will say that typically written into contracts, like subcontracts, it says you're responsible for maintaining documentation and would need to provide it at, if there was a request. So I would be sure that was stipulated for any
Right.
money.
Because like with grants, we'll keep a copy of it and we have a copy in house, but for everything else would be, maintained downtown. So I guess that's what I'm asking. Should we follow that? Probably, I guess we would follow that pattern.
Yeah, follow your standard protocol.
Okay. And then the other question is, as far as data collection, so some of these programs we put in place in planning that we were going to be getting these funding dollars. So even though we hadn't received the funding from the OSF, we had already hired a case manager, for instance, that was going to be spanning across the continuum. She was working between mental health, substance abuse. She's a docs worker. She was transitioning for the homeless housing. So she's already been collecting data, but then I guess that's what we were looking for, is should we change what she's collecting? I mean, I guess we were really hoping to have more information as to what data we should have, because it would be really helpful to kind of guide her now, so she doesn't collect what she doesn't need, or she gets what she does need. I mean, she is right now, noting, that the people, whether they have a substance abuse diagnosis, a mental health diagnosis, what their homelessness status is, whether they're on any kind of outpatient services or not, how the referral came, those type of things. But but I guess that's what we were hoping to have more guidance on, as to how to advise people on that.
So OASAS is not collecting data at the initiative or project level for the regional abatement dollars. For one, because it would be a gargantuan task. Two, everyone's doing can be doing any number of things, right? And there could be any number of downstream providers who are doing this work. And so, that's part of the reason why, we were using those priority categories to just kind of have a sense of what's happening in each of those areas. Again, for our initiatives, we are developing, there's data collection, and we're looking at measures, and we're looking at evaluation at different levels. So OASAS isn't advising or asking counties to provide more detailed data. So
Okay, because I know the settlements have that written in the settlements. That's why I was wondering. That's written into them because that was determining this, like, go back to that one allergen settlement. It says that year one's payment goes out, but year two's is dependent on what you're reporting data as to how many lives were impacted by the dollars in year one. So that's, I guess this is where legal comes in.
So that is where legal comes in, and I have to tell you that, you know, in consulting, you know, fiscal and with counsel's office, you know, we agreed and accepted that the report that we're currently getting from counties and we'll be getting on an annual basis is sufficient for us to meet the required reporting. And two, part of it with everyone doing so much that, you know, so many different things, again, it's hard to develop a standardized way of collecting and understanding all the work that everyone's doing. So that's why we kind of went with those 10 categories. What's the spending? Two, we're going to be doing some qualitative work. So we're going to be having those focus groups to better understand the process and also, you know, some of the work. And I'll also say this is only just the beginning, right? So it's kind of hard to say, oh, these are all the things we should measure. This is what we should look at. So, and it also speaks to, you know, on the state level, you know, we're developing a substance use vulnerability index. That's something that we can use over time to kind of assess where counties or regions or even zip codes are at, addressing, you know, some social determinants of health. And so that is our evaluation, right? And so we're using the information you're providing. We're doing that larger evaluation to be able to speak to the use of funds. I think that that's going to be more informative and more helpful. I think it's going to be both of those things, much more so than having each project executed using the dollars and having like a nominal amount of data collected from that effort to be able to explain all of what's happening across the state.
Okay.
Lucia, do you agree with that? Does that make sense? Lucia is my truth teller, so I check in with her every once in a while. Say, keep me straight, Lucia. Okay, other questions? All right, so always good to get together with you guys. I appreciate the work you're doing. Again, we'll just keep moving forward and getting it done. And we'll plan for that next regional abatement call to be with legal, so submit your questions. If in the meantime you have any other questions, concerns, thoughts, please don't hesitate to share them. Trevor just put up a question about the allocation for 2024. We did talk about our waiting for final numbers from DOE. Once we know what those final numbers are that we can use to calculate the amounts for each county and litigating entity, we will do that work. We will be sending out what stands as an award letter with the amount that you'll be receiving. Similar to, or exactly the same as, I should say, what we did last time around to make you aware of 2023 dollars. So I would love to say that that's going to be in your email on Monday, but I can't. Know that we will get it to you just as soon as we can. And then once we send that award letter, it'll trigger payment. All right. Good to see you. Good to have you on. We're here. So if we don't talk to you in the meantime, we'll see you at the next regional abatement meeting. Thanks, everybody.
Thank you very much.